Hello, everyone, and welcome to this very special edition of Volunteer Voices. In the next hour, you'll have the opportunity to hear from the senior leadership of Global Care Force, as well as two of our field leaders from Ukraine and the Middle East. And then we'll also be talking with some of our volunteers who have served multiple times on Global Care Force projects. Just remind you to keep your microphone muted unless you're speaking. And when we come to the Q&A section of the session, you can use the raised hand feature on your screen, or you can do it the low-tech way and just wave at me, and hopefully I will see you. We're going to begin with Dr. Gary Morsch, who is the founder and executive chairman of Global Care Force. And when Gary is finished, he'll hand it off to Roxanne Jones, who is our Vice President for Global Programs. So, Dr. Morsch, it's all yours.
Thank you, Rick, and thank you to all of you for joining us today. We got quite a powerful group of people on this call. But I have been involved with various volunteer activities, primarily in healthcare, most of my professional career, either as a volunteer myself in various medical or disaster missions, or working to organize teams to respond to great needs around the world. So this is a part of my calling and purpose in life. So the first organization that really took off was Heart to Heart International, and that's what Anne Schwanda is deployed to right now. And Steve Konecki is also a part of that disaster response team as well. And that's a very terrific organization that's sending, well, for instance, in Ukraine, they've sent $300 million worth of medicines into Ukraine since the war began. And so they're doing a great job. When COVID hit, I felt like we really needed to, it was an all hands on deck type of moment for me. And felt like we needed to really mobilize people. And so that was the start of COVID Care Force, which operated for about 3 years from the beginning of COVID in February or March of 2020, when we were first confronting it here in the United States. And as COVID became more manageable, we shifted to Global Care Force. And that's who we all represent today. The purpose of Global Care Force is to mobilize both medical and non-medical volunteers to areas of desperate need around the world. And so we don't pick sites to go to because of the ease of it, or because there's a lot of sightseeing that could be done or whatever. It's because there's a need, and we feel we have a particular niche that we can fill as we work with the local not-for-profits, NGOs, and certainly in many cases with the government and or the military. So and the foundation behind this idea is not only meeting needs of people, especially in places where they just really have hardly any or no access to medical care unless we're there. So it absolutely impacts patients' lives wherever we serve. But just as important, perhaps, maybe not, you can't really gauge this, but the fact that it transforms the lives of those who volunteer and serve. And we're very intentional about that. We're not just trying to throw bodies into places and check up a box, but we're really trying to create a system and a process that is transformative for every individual. And we've seen this happen so many times in the lives of our volunteers. So that's a little bit about Global Care Force. And Roxanne was brought on board when we were shifting to Global Care Force, and particularly to Ukraine, because of her extensive experience living in Ukraine, working in Ukraine, and all of her contacts there. So Roxanne came on board and is leading she's our vice president for global programs. And so she leads all of our programs wherever they are. So Roxanne, if you're ready, you can take it away.
Hey, Roxanne, before you go, we're gonna play the video.
Oh, okay.
Sorry, it's not on the agenda.
Some days can seem never ending, been apart for so long, trapped in a world of confusion. I hear your voice, it keeps me strong.
And then I want you to take your amlodipine. And then for your diabetes, you're going to take that twice a day.
Дуже важливо для таких людей, як ми, які покинули свою домівку. І, на жаль, проблеми зі здоров'ям є у всіх. Дякую вам.
Вони допомагають нам. 2 рази вже приїжджали до нас, забезпечують нас безкоштовними ліками.
Ми дуже і дуже вдячні, що вони приїжджають і допомагають людям. Таке важкий час для нас.
Home is the light in the darkness, when the world is spinning round.
We're starting our 5th day of clinic today. We've got a full house outside, ready to go. Everybody's getting set up. We anticipate about 140, 150 people today.
جيت الأردن 2019 واليوم في علاج طبي. جيت أنا وأولادي وكتير مبسوطة إنه قدرت أتحصل على الدكاترة ويتعرف على ناس جداد وأقدر أتحصل على العلاج يعني.
One of the problems that we have, of course, in the Middle East is the tremendous amount of upheaval that's been created by conflicts all throughout this region. There's a tremendous amount of displaced persons here, refugees, something along the line of 2.5 million refugees.
My name is Shang Haley in Pacifica, California. Here helping the Sisters of Missionaries of Charities manage the hospice center, and can't wait to volunteer next time.
I'm Jody Cook in Rosarito, Mexico, volunteering in a men's shelter for the Missionaries of Charities Sisters. It just means the world to the sisters, and it means the world to the old men that live here that we're caring for.
When we tell them that we're here to help you, they feel hope.
Nothing like feeling so safe inside. This is where my truth resides. I'm coming back.
And a lot of our patients are mothers and grandmothers who are sad. We need to feel these things together because it means a connection happened. They're short connections, but they're real. I'm very grateful, thankful that I've been able to be here.
These people came in a little broken, a little desperate, and some of them left with a smile on their face. It was good for me and the team to be able to care for those people. You know, not only did I get a lot out of it, but I know that these people that came in with nothing left with something.
Thank you. I have to admit that video gets me every time. I just get a knot in my stomach and my throat. And it's one thing to go, but then to see what you have been up to and what our work is all about. I'm so blessed to do the work I do. It's my purpose in life as well. And we have been working in Ukraine since September of 2022. We entered Egypt October of 24. We entered Jordan this year in June of 25. We've been working also with the Missionaries of Charity since the very beginning. They run hospices, mostly for men, in Rosarito and Tijuana, Mexico, and also outside of San Francisco called Pacifica, California. And you're going to hear from volunteers who've been to several of those sites, and of course, as well as our Middle East coordinator and our Ukrainian team leader there who serves with us. Our volunteers is what makes us. We couldn't do this without volunteers. And those who give, who can't go, that's why we're there, working together as a team, no matter what, whether you can give only, whether you can go and give. It takes all of us working together, and most importantly, those on the ground, such as Eugene and Imad. We are looking to expand as we are able, with finances, with team members, and so forth. We want to make sure our work remains purposeful. In Ukraine, we go every month. We send a medical team every month, and some of our medical teams include non-medical who also serve a vital purpose on our teams. And I could talk to you afterwards if you're non-medical and this would interest you. I could go over kind of your job description, so to speak, of what would you do? Because I get that question all the time. I'm not medical. What could I provide? And there's a lot that a non-medical person can provide. We are the only organization in Ukraine that provides continuity of care. We're like number one. There's other organizations in Ukraine working, but the difference is they hire local people to go provide medical care, and their medical care consists of just going to check up on patients. They might write a prescription, or they might give a medicine for a day or two. Our organization is different, where we go monthly, providing that continuity of care, and we also give out enough medications for a month until we return to that area. All of our work in Ukraine is in deoccupied areas. Once or twice a year, we do go to a city that has some huge displaced persons buildings, and we serve those that are literally in limbo, that have lost everything. And our teams see firsthand in the deoccupied villages where we go when we mean they've lost everything. There's many homes that there's nothing left of to live in, even a dugout basement. What I was told growing up, it's called a cellar. It's not a basement, but it's a cellar. And those are hand dug basements or cellars. And we do have people that we see that exist in those. We've been at it long enough in Ukraine that we're also seeing military personnel who've returned home due to injuries, emotional traumas, and all kinds of things. So now we can say, yes, we do see some military folks. We don't work on the front lines. We're about 30 kilometers from the front lines. We hear a lot, and sometimes we see things in the air. And so we prep our volunteers very thoroughly before they go, so they're not as alarmed as they would be if they hadn't heard of this before. EMOD is doing a terrific job in Egypt and Jordan, In Egypt, we have seen people in refugee centers. We did go to one Coptic Christian church, but the peoples in these centers mostly are from Sudan, who literally were met at their front door with a gun in their face and were told, "You're leaving now. You can't get anything. Just pick up your children and go." One lady told me, I tried to turn back to go get some gold bracelets that I could later use for money, but they wouldn't let me. And my husband wasn't home, so he didn't know where we were for several days. And we were privileged to work with these people groups as well. In Jordan, we're allowed to work in a church with no problems. The government turns a blind eye as long as you're within that structure. And so in Jordan, we choose to work in churches to be able to do our work. And we've been very successful there. Had our inaugural team in June and saw a great number of patients, had a wonderful team in Jordan to work with as we did in Egypt. And so we're looking forward to continuing the work there. Missionaries of Charity is sporadic. They can take volunteers as little as a week. And some people are not able to get 2 weeks off to go with a team to Ukraine or the Middle East. And so they opt for something that's closer to home and less length of stay. But that's what we're doing as far as our programs, and we're looking to expand. We don't know where just yet. We've got a couple things as possibilities on the horizon, and so we will be looking at those things for next year or 2027. Thank you.
Thank you, Roxanne. And as she said, we have Imad Amari from the Middle East with us today, as well as Eugene Onofrichuk and from Ukraine. And I have some questions for the two of you. And I know you can't go into great depth, but we'll appreciate any light you can shed on these questions. So each of you serve in regions experiencing profound humanitarian challenges. And building on what Dr. Morsch and Roxanne have shared with us about how Global Care Force first became involved, we'd like to learn more about your teams and the communities that you serve. So beginning with you, Eugene, can you tell us a little bit about the extended field staff who support these efforts and how their contributions make a difference on the ground?
Thank you, Rick. Thank you, Gary. Thank you, Roxanne, and everyone for inviting me here and giving me a word, because actually, if we take me almost 3 years ago, when I was firstly involved to Global Care Force, I will never say that I'll be here on this call with you and talk on behalf of the team leader and on the Ukrainian team, because as Dr. Gary says, it really transforms lives for volunteers. And I can confirm that my life was fully transformed with Global Care Force. Both Ukrainian field staff and the volunteers who come from abroad, they become a family which serves together, lives together, and does the same job for 1 week. And this is what really makes the mission special. Each of the missions, when the teams are sent every month, they are not the same. They are different all the time. The volunteers are different. Somebody come back, somebody come for the first time, but each mission becomes different because we see different things and we serve differently. We serve differently, but the purpose remains the same. Actually, we come here to serve. We serve, and we always see the result of our service. Actually, referring to your question in terms of the Ukrainian team involved, we usually have a specific number of those who are involved, and they are both translators and clinic administrators like Luba. Those who served in Ukraine, they know Luba. Most of those who served know translators who are always involved and always are ready to serve every month. We know Andres, you know Maria, myself, because before becoming a team leader, I was more serving as a translator. And Dr. Lev, of course, who is our irreplaceable medical director, who contributes a lot in terms of medications and coordination of our work in Mykolaiv region. For now, it's Mykolaiv region mostly Snihurivska district, which is a small part of Mykolaiv region, very close to the border of Kherson region, which is actually, I think, 30 kilometers from the 30 kilometers from the Russians. They stay on the left bank of Dnipro, and we serve on the right bank, at least 20-25 kilometers from there. And the community is called Snihurivska, as I said, and the community includes from 10 to 15 villages, which we regularly visit. We started with a couple of specific villages, which we try to return to, and with other villages consequently adding with the need of medical care growing up there, because of course the situation becomes worse. It is known to everyone. The situation is unstable for everybody here, and that's why the need for care only grows up with every day. Even though we come back there, we are still needed, we are still required, because when we see people, those who served in Ukraine, they know what actually people requires there and why they come back to our clinics. There is no person who never come back at least once or twice to our clinics, because every time they receive a specific, they meet the specific need which they primarily require. Somebody comes for medication, somebody comes to share about their problem or about their health condition for the first time, but they receive actually in a 100% of cases what they needed before. About I'm not going in details about the process of our clinic, because everyone knows about it, everyone knows, especially those who served here. But in Ukrainian, the main challenge which we face nowadays, and we've been facing for the almost 3 years of service, is that most of the volunteers, they were not expecting the so efficient, highly effective level of care which we provide to people, because really in a couple of hours, 3 or 4 hours, which we serve in the specific place, in the specific village, we provide a huge amount of things to people, because we always carry not only our knowledge or not only our medical background with us. We carry the specific instruments. We carry always ready to manage the simple pathologies in terms of surgery, in terms of cardiology, and all of that. We are prepared to any case. We are prepared to any scenario in the field, and that's why I can tell that the level of care becomes especially effective and efficient. Is that actually meets what you've been asking, or I missed something, Steve?
All right.
Oh,
thank you. We'll come back to you, Eugene. Imad, your context is very different. Talk to us about what your team looks like, and what kinds of challenges are you facing on the ground there in Egypt and Jordan?
Thank you for this opportunity to share a glimpse of what the Global Care Force do in the Middle East. When I met Dr. Gary and Roxanne 2014 in February, and hear about Global Care Force, I said, wow, amazing. What opportunity to help them in these missions and in these clinics. I saw their hearts, so it touched my hearts in that time. And then they came back in July. They asked me if you want to go with us and to do a survey in the Middle East. We went like Lebanon, and Erbil and Egypt. and also Jordan, of course. So when we went Egypt and we saw the area, the poor, the community in the some villages, people are so bad situation that we saw a big need. And when I joined with them and do the first clinic in the Egypt, Dr. Steve was with us, and we go in a full area of Sudanese. The Sudanese people, they looking, they come flee from Sudan's, looking for a shelter without no food, no clothes. They want a place to be and safe. They found themselves in a cold weathers and hot weathers also, without shelter, no food, and no medical care. So when we go and serve in this in church and school and education center there for Sudanese people, they were grateful that we are available to support and help and looking for to give them the medical care. Actually, they still contacting me, looking for our service to come back, our doctor to support them with the with the free medications. It was a great time that people we support the people that they are without any help or medical care. In the poor, in the worst places you could imagine. I saw, like here in Jordan, we deal with Sudanese and with Iraqi refugees. They were also in need. But when we go to Egypt, I saw the worst than they have here in Jordan. Even here in Jordan, we serve Iraqi people, refugees. They are refugees also, flee from Iraq because they were almost killed there. Many story of people were threatened with guns and just leave your home, leave everything behind you, and take your kids and your wives and don't be here. Yeah, many stories I hear because I deal with them in our church and we serve them here in Jordan. They are in trauma. They looking for any help here in Jordan, and they can't work here in Jordan also. Thousands of Iraqi and also Sudanese, they are prevented here in Jordan to work. No sources of money to get medications, to get food. One lady said, come to our clinic. She said, I couldn't, I come to global, to this clinic because I hear that you are coming and help us. She said also, if I didn't come to you, also I haven't money to go to the clinics. One story, I believe Dr. Steve remember in Egypt, a lady come to us with a trauma, with a cancer in his abdomen. It was yeah, you can see it. It's like a ball here. She was looking for a painkiller. No, she couldn't have it. and I saw her laying down. I said to myself, why is she lying in his side on the chairs? Then I found that she couldn't go to get a treatment for the cancer, and she is coming just for a painkiller. We support her with that. When we go to an Egyptian a worker that he fall and he could almost broke his legs and couldn't move. Me and Dr. Steve in his house. He was thankful, and it was a great time with him, and he was uh, pleased because we come and help him and give him medicine in that time. And we sorry, I can continue. Yes.
That leads really to my next question about the kinds of patients you're seeing, and what are the what are the greatest needs when Global Care Force says that we provide primary care and free medications. What are the main needs that you're seeing? If you could answer that, and then we'll ask you.
Yeah. The majority of them they want the diabetes medicine, the blood pressure medicine. It's a big need for them. Some of them, they just like Sudanese, they cannot find a food here. They want vitamins to support themselves.
Eugene, what kinds of conditions are you seeing there in Ukraine?
Yes, thank you, Rick. Actually, the patients which we see primarily, I must say that all of them were staying under the occupation for 6 or 9 months. Some of the villages stayed under occupation for 6, some of them stayed for 9 months. So first thing to mention is that each of the patients who comes to our clinic had all of their chronic conditions they had before pretty much aggravated or exacerbated. For example, older patients, mostly at the age plus 70 ages and 70-year-old and older, they come with a bunch of chronic conditions. They are comorbid patients. They are patients which have at least 2 or more chronic conditions such as hypertension, ischemic heart disease, diabetes mellitus, chronic kidney disease associated with each of the said above, chronic arthritis, chronic musculoskeletal disorders, pain, which is also very frequent condition, which is getting addressed to our clinic. All of that combined combines another condition, which is called mental trauma. Mental trauma, which patients received under the occupation, makes all of that what they had before much more severe. They have each of the disease become more severe, more visible for them, and that's why all of their health abnormalities should be managed in complex. And that is what actually we try to do, to manage everything with the short consulting, with the quick response, what actually patient has at the moment. Of course, as we said already, many patients come back to refill their medications which they received before during the previous consultations. But if anyone comes for the first time, they will get examined, they will get analyzed in a case of what actually they need the most and be given what they need. Thank you.
Yes, thank you. We know that in the Middle East and in Ukraine, we're sending teams into very unstable environments. A conflict zone, of course, in Ukraine, and in the Middle East, large refugee populations. When we talk to prospective volunteers, they understandably have questions about safety. So what measures do you take to keep our team safe in those environments? Eugene, go ahead.
Thank you, Rick. So all of the work of our medical teams, of our deployments, had been regulated by the state military office. Our state military office, which is headed by Vitaly Kim, the head of the office, is actually some of the representatives of the American team had met Vitaly Kim, I mean Roxanne and Dr. Gary Morsch. And since our first deployment, Vitaly Kim and his military office team has been tracking the condition in the Mykolaiv Oblast, in the Snegurivska district, which we usually visit and serve in, and inform us, especially me and Dr. Lev, about the conditions and the safety measures which should be taken before we arrive at the area. For example, if there is a specific aggravation of military condition in southern part, for example, of Snegurivska district, we might skip that villages for the next mission. And the work of the coordination of the clinics, the choosing of the villages which we are going to serve, also is getting coordinated through the military office. Because safety, as we said many times, is our main perspective, is our main rule to keep our team safe and to go to serve only in the areas which are safe to serve in. That's why our primary thing is to connect military office, to stay in touch with them, and to know in time what actually will or won't happen in the specific area, and adjust our missions to the safety conditions.
Thank you.
Especially to add, I'm sorry, I have not finished. If we speak about military safety, and if we speak about the safety of our teams, if we speak about medical safety and safety during the clinics, we always keep the track of the medical condition of each team member. We try to know if somebody gets sick, if somebody does not feel good during the clinic or before it or after it. That's why we are always ready to respond to any And sorry, connection. Yeah, I'm back. And that's why we always are ready to respond to any health problem in the team. Thank you.
All right, very good. Imad, how would you respond to that question? How do you care for the safety of the volunteers who come?
Yes, our team safety is our priority because we are in an environment that not allow to us to speak anything, to get touch with the anyone without permission, and we suddenly have a situation here in June in Jordan. We suddenly found that there are missiles above our heads. Iran shoots Israel, and so we stuck with our siren to if it's say you have to be in shelter, to be in your home, don't go outside, because anytime maybe missiles fall down. So in that not a normal situation, but it happened. Yes, so any restrictions we will follow in if it's coming to us. But normally it is a safe place to work here in Jordan and Egypt. Even we have struggling with the permissions to work here in Jordan or in Egypt. So we'll stuck in like in churches, opened a door for us to work through the church. So we will go to serve here in Jordan, also in Egypt.
Well, there are so many questions we would love to ask the two of you. We just want to say thank you for your leadership, for all that you're doing to assist our teams and help the people that you serve. Thank you so much. And with us today, we have some folks who have volunteered with Global Care Force. We have Darlene Timmerman, who has been on projects to Ukraine and served with the Missionaries of Charity, and also Steve Schwanda, and he, along with his wife, have been to Ukraine and also to Jordan. So we have some questions for you. Darlene, let's start with you. Just tell us a little bit about yourself and what drew you to serving with Global Care Force.
Well, I'm a nurse. I retired after 44 years as an RN, and my passion has always been oncology nursing. And that seemed like maybe a disconnect with what we're serving for, but actually it became very clear that it was actually a really good connection. So, but anyway, after I retired, I was really, to borrow the same phrase I've heard twice already, but what is my purpose? And that was kind of what led me to really consider volunteering in some capacity. And then fast forward, actually just a couple of months, I met Roxanne Jones from a neighborhood event, and she was sharing with me about her work with Global Care Force, and I was immediately, I just couldn't stop thinking about that opportunity, and it seemed like exactly something I kind of wanted to do. So that whole identity, the call to service, all of those things, I certainly identify with, as the others have mentioned. Anyway, so that's how she told me about what was happening in Ukraine, and so I got on board right away and went in April of 24.
Very good.
I can talk for a long time about my experience.
Okay,
so
great.
I'll just wait for you to ask me questions.
Yeah, okay. Well, here's a follow-up question. Share a story about someone that you met or an experience that you had that will stay with you for the rest of your life.
That's kind of that's a great question. And I've kind of pondered it, and I can't tell you how thrilled I am to see Eugene's face today. I'm probably getting teary. He may not even remember me. He's seen so many volunteers, but that team of people that were in my group were just absolutely incredible. And it was actually them I've never met. And that includes a couple of us from the US, and the other nurse that was on my team is from New Zealand. So we really were kind of a melting pot, I think. But I've never met a group of people from all over the world with the same commitment and power to change, to do something, to really give of themselves. And they were just a committed, amazing group. The dynamic was amazing, and I'm just really thrilled. And that's actually maybe what I remember most, is that genuine, authentic, in the organization was phenomenal. Like I think Eugene may have said, and we would go in a clinic area and just like immediately sort out, okay, you're going to sit here, let's do this, let's do that, boom, we're seeing patients. I mean, it's just a really, well-oiled machine, so to speak, of how it went. And I was just so honored and privileged to be a part of that team. But thank you to Eugene for his amazing leadership and compassion that I'll never forget that. So.
Thank you. Yeah, when we see the pictures of the teams, it's the 5 or 6 volunteers, but then also the local staff, the drivers, the translators, the physicians. And I know that very close relationships develop over those 2 weeks together. Steve, I'd like for you to respond to that question too. Tell us a story or a life-changing experience, but first introduce yourself and give us a little background.
Oh, yeah. My name's Steve Kenneke. My wife's name is Ann Schwanda.
Oh, sorry.
And that's all right. And she's down in Jamaica right now and has been trying to connect, but has been unable to connect, or she'd want to be in on this too. But yeah, I'm a retired family physician. Probably did my residency and first 7 years in the Army, mostly in Europe. Then went into private practice for another 30 years or so. I had gone to Haiti with Heart to Heart back in 2013 and had a wonderful experience there. And in retirement was looking for more volunteer opportunities. I feel that kind of acts and deeds are kind of what define us, and kind of is good for our soul. And my wife Ann found Global Care Force and some of the work down south with vaccines. And when I found out it was another organization run by Gary Morsch, I said, this is definitely going to be a time well spent as far as volunteering, volunteering medically. I've done about 4 trips to Ukraine, a trip to El Paso, Egypt. So pretty much just got the highest respect for all the global care force people that I've dealt with. And when you ask for kind of memories or things that stand out, I was hoping to see Dr. Lev. I like seeing Eugene, but I was hoping to see Dr. Lev as well. He really stood out, the medical director of the Ukraine group. He's volunteered in Bakhmut during the height of the fighting there. And that really stood out for me. I know we did a medical clinic in the Mykolaiv area in a small clinic that was run by an EMT who was the town doctor. And she was so impressive when they were occupied by the Russians. She was kicked out of her clinic and they used the clinic for their barracks. They kind of wrecked the place. And she would go around town at night, kind of on the, just secretly to treat different people in town. I remember my first visit to Ukraine. I think we were in a town called Vapniarka, where we went to a church service. And they had during the service, they took the children all went up in front and asked for prayers for the soldiers. And they asked for prayers that no missiles would fall on their town. And I found that very, very touching. And I just one last thing. I really found this very especially rewarding on the Egypt trip. It's so nice to practice medicine where you depend on your history taking skills and your physical exam skills when you have very little lab and very few other resources, and you really go back to very basic medicine. I found that the challenge very very enjoyable. And lastly, I always get more out of these missions than I feel that I give. So I'm happy for the opportunity.
Yeah, thank you. And, at times like this, we dwell on the positive, and you're sharing all the good memories and relationships that have come out of it. What were some of the more challenging aspects of your time serving with Global Care Force? What would you share that was really challenging to you? Darlene, go ahead.
Sure. Yeah. Well, just right off the bat, it was that sleeper train, that was challenging, but it worked out okay. But then, I can dig a little deeper, I think, and realize the destruction and devastation that I saw was really hard. And then I remember sitting at a table one time with Luba and just got teary thinking about how much I have and how little they have, and kind of she helped me, which is anyway, to work through kind of that guilt of, this isn't fair. How can this be? How can these people be suffering? And I have it so easy, in Kansas City. And those are the things, I guess, that,
Yeah.
that struck me.
Mm-hmm. Yeah. How about you, Steve?
Well, the thing that struck me, it was very sad. In the 4 trips to Ukraine, each trip, more and more of my patients had lost somebody in the war. The first visit was maybe, I don't know, about 6 months after the war started. I forget how long it was, but with each following trip, more and more had personal experience of losing a loved one in the war. And that was very hard.
Mm-hmm. If the two of you were talking to someone who was considering volunteering, but kind of, on the edge, not sure whether to go or not, what would you say to them to try to persuade them that this would be worth the time and the expense to volunteer? Steve?
I mean, it's very well organized. Definitely see a lot of patients. So, I mean, you're definitely not sitting around. You're very, very busy. I think you make an impact. Ukraine, I really feel that if we can let our patients know that they're not forgotten. Same with I basically in Egypt, in Cairo, seeing the Sudanese. The sad thing there was mostly women and children who had left the men behind. And again, just letting these people know that they're not forgotten. Same in El Paso, that people have made a 4 or 5 month trek to get here, and that there are people in this country that care about them and are welcoming. And I'd say that for a small amount of effort and significant piece of change, that it costs to do these missions, that it's money well spent for what you get out of it.
Thank you. Darlene, what would you add?
Well, I certainly agree with Steve's comments, and I think also, and this was certainly true for me, is to really consider my reason for volunteering. What do I, what's my heart? What's my purpose? And once you answer those questions and feel confident, then just go for it, and learn as much as you can, ask as many questions as you need to feel that confidence to go forward with the trip. And I guess on that end, I would say, I would be very open to having conversation with anyone who is interested in going on a trip like that and answering any questions they have, because I think that's where sometimes the fear of not knowing kind of holds people back too. So.
Thank you. Well, Darlene and Steve, we appreciate your participation today. We're so thankful for every individual who volunteers with Global Care Force, but people like you who come back again and again, we're especially grateful for. So thanks for your service, and thanks for sharing with us today. We have just a few minutes left for anyone that might be watching this video later and might have a question. What did we not cover? Are there any questions that any of you would like to pose to Gary or Roxanne or to Eugene or Imad? Yes, go ahead. I see your hand. I don't know your name, but go ahead.
Is this for me, Marty?
Yes, Marty, go ahead.
Yeah, well, I go back with Gary and Heart to Heart back to the 90s, to China and Russia and along the Silk Road. And besides the memories, I want to just ask a question relative to your work, particularly in Egypt with the Sudanese, because I plan to volunteer after I get my book done. And that is, what are the connections that you have after you get primary care and medicine and maybe deal with the original trauma? What do you do to connect them, say, with food banks and with housing options? Do you have those kinds of connections so that after they leave, you are able to give them a few possibilities?
Imad, would you want to answer that question regarding the healthcare services and social services available in Egypt for the people that we saw? Like where they can get assistance?
I'm not sure I get everything. What he want to know, how we connect with them?
Once we see a patient in the clinic, how do they go get, is the government provide any food for them or clothing or any kind of money where they can go to different social centers to get that assistance? I know that in Egypt, Marty.
In Egypt, it's a common there. There's many churches support, but for us, I don't. Maybe doctor that we work with them there, he know better than us, because I I just go into Egypt with the Global Care Force. But in Jordan, I know many churches, one of them our church, that support with the food packages to many Sudanese, Iraqi family all the time. Yani almost every 1 month, 45 days, we support them with a package of food. I believe in Egypt they do something like that. But in Egypt, the situation is not very good also for the Egyptian people. They were struggling with the income, and their currency is not strong enough to even to their people to support themselves. But I believe they support them with food for Sudanese, I believe, but not too much, because thousands of people there in Sudan, they need a big, huge support. So, as Global Care Force couldn't help everyone, but even though we do amazing job there, in 7 days we saw 1,200 patients. We're supposed to see like 700. See?
Thank you, Ahmad.
A lot of needs there.
Yeah, and thank
Marty?
you for the question, Marty.
Marty, the other thing I noticed in the refugee centers in Egypt where we worked is one of them had a free school for children, and the teachers taught as a volunteer. And I know they also supported with clothing and food at times too.
Anne, you had a question. Go ahead.
Yeah, I wondered what the situation is in Haiti, if Heart to Heart Haiti is still able to operate.
Dr. Morsch still with us?
Put on mute. Maybe, yeah, there I am. Okay, thank you. Sorry. So I have, in fact, I had a video call just 2 weeks ago, perhaps, with Josue, who led our Heart to Heart operations there after Steve Weber returned to the United States. And Josue is working very hard there. Global Care Force, in partnership with the Church of the Resurrection here in Kansas City, has done 2 or 3 projects, funded 2 or 3 projects in women's empowerment, and also in getting food out from the countryside into Port-au-Prince, where there's a lot of need. So Heart to Heart has been reincorporated in Haiti under a French name that I never can remember, but the clinics are going, and they're carrying on the work on behalf of Heart to Heart.
Wonderful.
Great, thank you. Okay, one last quick question, Gwen?
Yes, this is actually for Roxanne. Roxanne, you mentioned volunteer opportunities for people that are not medical, such as myself, and that I would be interested in volunteering, but not quite sure where I would fit in.
Sure, Gwen, I get those questions all the time. There's many things non-medical on the teams. We have the people that we see. We just had a volunteer go with her husband, but she wasn't medical. She worked, did, I guess, some trauma care. She had her own translator, as everybody does. And she sat and talked with the people. She had some background in like stretching and a little bit of exercise things. She showed them some exercise or stretches. But the first thing I asked her to do, would you just be with the people? Would you sit and collect stories for us? And with her own translator, she was able to do that. And she was actually one of the most valued people on the team, from what I heard. And so if you have an open heart and open hands, mentality or servant's heart, if you will, you will find yourself well used, and as long as you're available.
Thank you.
Thank
You're
you, Gwen.
welcome.
We've reached the end of our hour, and thank you all for your participation. It's been such a great discussion, and we look forward to future times like this. I'll turn it back to Dr. Morsch for any closing remarks he has, and then we'll be finished.
Thank you, Rick. Thank you, everybody. This is always inspiring to me to hear your stories and stories of impact and transformation, and it's amazing. So you really motivate me to keep going. I wanted to make a short introduction. One of our staff on the call has been promoted to Executive Vice President, and that is Lauren. Lauren, would you want to say anything in response to that, or like just God help me?
God help me. Yes, that's probably one of the things I am crying out for. But no, I mean, I appreciate the introduction. Gary, you want to mute me? I can hear myself. Sorry. Yeah, it's, man, I hear myself. Maybe it's, I don't know.
You okay?
Echoing.
We can hear you okay.
Okay, I hear myself twice. So, joined Global Care Force in May of this year, and I think 4 days into my time at Global Care Force, Gary had me on a plane to Ukraine, and I think once you experience fully what Global Care Force is about, it's hard to turn an eye away, whether you're a professional staff working in the organization or a volunteer, whatever your capacity might be. And I think over the last 6 to 7 months, I've been driven to find ways with my background. I come from a non-medical background. For those that don't know me, my wife is an RN. I run at the side of blood, so it's not a great fit in that sense, but I do bring a sort of global international development background. Lived and worked in Washington, D.C. for on and off for about 20 years. So hoping to leverage that experience and that network to help build the brand and visibility of the organization. I think one of the things we do sitting on a call sort of intimately in this space, we all know the good work we do. And I think the important thing we need to do is begin to tell and to share that narrative broader community so that people know, what it is that we're about. And we take for granted, I think, because we've done so many missions. Roxanne and the team in Ukraine in particular have done 33 teams, I think 33 deployments since the beginning of the war. And Darlene, you mentioned that the train trip. I tell people that the itinerary I endured in and out of Ukraine was the most challenging, I think, in my career. And I've traveled to a lot of different places. And I think, we shouldn't take for granted the complexity, the logistics. Steve, you mentioned how well organized things are. I mean, Eugene, Lev, and the team on the ground, what they've put in place. We've had a couple of deployments between Egypt and Jordan, continue to build that program out. And I know we have ideas for other places that we would like to serve, because the reality is that there are all kinds of places in the world that are in need and that need others to come alongside in whatever capacity we can to help. And it feels like maybe a drop in the bucket, but one of the things we talked about with some of the networks we're building out in Ukraine is that, when you combine all of the organizations in their own way, trying to make an impact in Ukraine, that you're part of something larger, something bigger. And so I think if we appreciate that it maybe seems like we're only having that one patient interaction, that one impact, that when you multiply that across the dozens, of organizations doing similar work, you can take a hopeful look at what we hope will be a positive outcome at the end of the war. And so anyway, I look forward to assuming this role. We have a lot of challenges and opportunities ahead. We have a great team at the helm, both in the field and in HQ. I always say DC because I'm so used to saying in DC, but I'm not in DC anymore. But yeah, if you have any questions for me, I'd love to sit and talk with any of you and learn. And maybe, you guys provided some experiences that you've learned from the positive and some of the challenges, but I'd love to also hear, things that maybe we can be doing better to make the experience for the volunteers as positive as possible. I know Roxanne has a debrief with everyone post-trip, and that's part of that. So we look forward to continuing the conversation. Thanks for your time.
Yeah, and then I want to give a shout out to someone on this call that is the first person to make a gift to the Global Care Force Endowment Fund. And that is Gwen Young from California. She's not medical, although she's very experienced and in a senior leadership positions in the California government. But thank you, Gwen, for that. So, and it's just great to see so many people from the past, from Heart to Heart Days, and now COVID Care Force and Global Care Force. So, God has a purpose for each of us, and what we can give may be small, it may be dangerous, it may be difficult, but you know what? He calls us to serve each other and others in need. So we're doing God's work. So thank you so much for joining us today.